Welcome, everyone, and thank you for attending Project Cure's Mental Fatigue on the Frontline webinar. I'm Aubrey Bookman. I manage the clinics and college department here at Project Cure. Our department deploys teams of both medical and non-medical professionals to partnering facilities to offer sustainable medical treatment, training, and community health education while working shoulder to shoulder with in-country healthcare staff. We plan on getting back to travel as soon as it's safe to do so. I've put our link in the website, a link to our website in the chat. Please check it out for more information if you're interested in joining us on a Cure Clinic trip. Earlier this year, Project Cure partnered with Helmets Helping Heroes and Civil Initiative Support Center to offer this webinar, Mental Fatigue on the Front Lines, to medical providers in Kazakhstan. Now, Project Cure is excited to host this talented team of medical and mental health professionals in providing this webinar to our healthcare heroes here in the US. COVID has induced a great deal of stress and trauma for everyone, but especially for frontline medical workers. Since trauma can manifest itself long after experiencing stressful events, we are providing this webinar as a way for medical professionals to identify signs and symptoms of trauma and stress and further develop tools to help them cope and build resiliency. We are pleased to be offering this webinar for free, but hope you'll consider making a donation to help support Project Cure as we continue to provide the equipment, training, and tools necessary to help save lives in under-resourced areas across the world. You can text Give Hope to 33222 to donate, or click on the donation link that I put in the chat. Now I'd like to introduce our moderator, Lisa Ellman-Grunther. Lisa is an allergist and immunologist in practice in New York City. Lisa was the driving force and co-founder of Helmets Helping Heroes in March 2020, through which she and others donated oxygen helmets and masks to thousands of vulnerable people throughout the US. Thanks to the relentless efforts of one of her co-founders, Linda Schwartz, our organizations cross paths and we've been able to create these valuable webinars. I'll pass it off to Lisa to get us started.
Thank you, Aubrey. Hello, everyone. My name is Lisa Ellman-Grunther, and I want to thank you all for your role in fighting this pandemic. We all know too well the effects of this pandemic on mental health. This has been detrimental to each and every one of us in some way, but especially to healthcare workers on the front lines. Effects of trauma can be long-lasting. This was a motivating factor for our effort to create this webinar in order to support and provide resources to our frontline workers, to whom we are all so thankful. I am so honored to be moderating today. It was through the frontline care provided by my close friend and colleague, Ricky Lean, that the mission of our group, named Helmets Helping Heroes, was identified. Not only has Ricky been working as an emergency room physician providing frontline emergency care since early COVID, but she also spends her free time researching technologies that can help her patients. During early COVID, she informed us that she had read about helmet-based ventilation as a life-saving alternative to mechanical ventilation that was being used in Italy, and motivated our group to find this option in the US. We were a group of women looking for a proactive way to help fight this pandemic. We met virtually every day and were able to find this technology in the US. At that time, it was only FDA approved for barotrauma and was not in regular use by emergency room or critical care providers. We were able to raise money to purchase samples and provide them to hospitals throughout the country to test out. Through further outreach efforts, we were then fortunate enough to be introduced to Project Cure as an organization. It's so amazing to have been able to connect Ricky, our two mental health providers, Allison Feinstein and Michelle Berniker, to the Project Cure team, which includes Grace Kistner, a frontline worker, also on the panel today. For any questions that you have during this webinar, please post in your Q&A box and we will address them at the end. So now I would like to officially introduce Dr. Lane. Dr. Lane is an assistant professor of emergency medicine at the Icahn School of Medicine at Mount Sinai and has been a practicing attending physician at New York City Health and Hospital, Elmhurst Hospital in Queens, New York over the past 20 years. She is a clinician, educator, and passionate patient advocate in the underserved, largely immigrant community the hospital serves. Since the start of the COVID-19 pandemic, she has had a growing interest in consequences of healthcare worker stress, complex PTSD, and understanding various ways mental trauma can be addressed. She has also worked with Helmets Helping Heroes to address resource needs since the beginning of the pandemic. Dr. Lane has a BA in psychology from the University of Michigan. She received her MD from Tel Aviv University and completed her residency in emergency medicine at the Icahn School of Medicine at Mount Sinai.
So As Lisa said, I am an emergency physician at Elmhurst Hospital in Queens, and I've been practicing there for 20 years. It is the largest public health system in the United States, has 545 beds and over 110,000 emergency department visits each year. We serve over 1 million people, and the vast majority of our patients are immigrants. Many of them are undocumented, and many of our patients are really the front line of society. So meaning our doormen or Uber drivers, grocery store workers, construction workers, nannies, housekeepers, grocery stores. So these are the people who are restaurant workers, really like in society's face every single day, and the backbone of our workforce in the area. So these headlines give you a sense of the magnitude of the crisis in Queens and Elmhurst in particular at the beginning of March of 2020. So this is the front of the hospital. You could see patients lined up around the block to be seen. Another headline about how overwhelmed Elmhurst was, but some of the other hospitals were not. And then for a minute, I'm just going to talk about the ED volume. So basically, our baseline volume is about 200 to 250 patients a day. And by mid-March, we had 350. But really, at the beginning of March, those 200 to 250 regular patients that we would see had actually been replaced by COVID patients. So the percentage of patients who were coming to be evaluated for COVID, even though they weren't sure they had COVID, was extraordinarily high. And pretty much we felt like every single patient had COVID, and it was close to that. So the patients with regular complaints had sort of disappeared. So the alarm bells were a little slow to go off in terms of our volume. The volume was kind of the same, but who the patients were had changed completely. And then by mid-March, our volume had really almost doubled. And then after that, our volume declined. And so you could see in this paper, in this graph, what that represents. 2019 is the gray line and 2020 is the black line of our volume. And then we saw something very similar in terms of acuity. Our baseline admission rate is about 15%. So 15% of our patients are sick enough to require admission to the hospital. By late March through May, 20 to 60% of our patients were being admitted. And you can see that similarly in this graph, the admission rate. So our patients were critically ill. All right, so what was the impact of this on our staff? And these headlines that are coming up really give you a sense of the magnitude of the trauma experienced by the physicians. So none of us will ever be the same. This next one is one of my colleagues who, out of desperation for resources, went to the New York Times. It was an act of incredible bravery where she went to the New York Times and said how terrible the situation was, how overcrowded, how we were nearing running out of resources, and she really garnered us a ton of attention and support, but it was an incredibly brave thing to do. This next article gives an in-depth look at the daily struggles of an emergency physician inside Elmhurst. The article describes just the density of the patients, how ill the patients were, scrambling for resources, as well as her emotional struggle with everything that was going on. All of these articles are linked at the end. Okay, so prioritizing staff resilience. What do we want to do? We want to try to prevent illness, burnout, PTSD, depression, and suicide. So one of the ways that I started to think about this was to use Maslow's hierarchy of needs. He developed this framework for human needs and motivation in 1943. And I just thought it was kind of a good lens to prioritize staff needs and psychological health of your staff. And what you realize when you look at this in depth is that even basic needs are very hard to meet. So basically the pyramid kind of puts physiologic needs at the bottom, including, food, shelter, sleep, and safety. Those are pretty much the physiologic needs. And then you get a little more into the psychological needs in terms of esteem and love and belonging. And then really at the top of the pyramid is this fulfillment and self-actualization. And so when this was developed, Maslow originally thought like the physiologic needs needed to be met first before addressing any of the others. But he later revised that all of these things can be met simultaneously rather than sequentially. And I think that's really what I saw play out in our department during this crisis. So just to go into specifics a little bit, the physiologic needs, even those basic needs for water, food, shelter were very difficult to meet based on PPE. People were isolating away from their family. People were so stressed out, they couldn't sleep. So just those very basic things you can't even take for granted. So whatever you can do to help your staff with those things is really helpful. People dropped off food. It just was incredibly helpful. And as basic as it seems, it really, really helped a lot. Same thing, safety needs, basic personal safety was really threatened. And so how do you test, how do you treat your staff? How do you protect them? Another thing that was huge was the financial struggles people are going through. Often their significant others were sick, they were out of work, they struggled with childcare now that they were working so much more and childcare was less available. So financial concerns were huge as well. Okay, then you get kind of toward that middle psychological part of the pyramid. So there was a huge danger of people feeling isolated. It was extraordinarily hard to stay present with your non-work life because it was all consuming, the work life situation. On the other hand, on the upside, there was an increased connection and something really to be leveraged, that connection of the shared experience with coworkers. No one could really understand better than the people who were going through it at the same time. Some of the things that facilitated those connections, we had a WhatsApp group chat, which really became a lifeline for communication. Our hospital developed something called battle buddies so that there were groups of people supporting each other, checking in on each other, really so that nobody was left behind, to kind of try to capture those people who didn't have the strongest connections. We had debriefing groups and a group called Helping Healers Heal, and they would work one-on-one or in groups. And then there are tons of free counseling resources that we kept trying to make people aware of. And then in terms of esteem and self-actualization, this was actually a tremendous opportunity for people to have fulfillment. The fascination of the disease was infinite. And so intellectually it was extraordinarily stimulating, but also there were so many opportunities to help and really for people to step up and grow, and also just taking the time to appreciate each other and express gratitude for each other, stepping up. And everyone who I worked with really became a family. We were a family before, but it became so much more, and everyone stepped up in unbelievable ways and took on additional roles. And you saw that people actually were able to kind of, while they might have lost at the bottom of the pyramid, they were able to gain kind of at that top of the pyramid. Some of the pitfalls, the waiting room, the last thing we would ever want to do is become a super spreader event. And it took a little while before everyone was wearing masks and being separated. There was some delay in the hospital acknowledging that they were overwhelmed. Other hospitals in the area were empty, and Elmhurst was so overfull, but especially with that volume replacement in the beginning and not really having the awareness that it was, more of these kind of patients, there was a delay in realizing how much help we actually needed. Same thing with PPE. At the beginning, it's a few patients at a time, and that's when a lot of staff got exposed. Everyone didn't realize the magnitude of the volume, and so PPE was kind of sporadic at the beginning, but that's when so many staff got sick. Again, the break room, the snack room, it was actually my mom who called this to my attention because she saw on Facebook posts of people hugging in the break room, and it was almost like a faulty logic. You feel safe and you feel like you're on the same team as your staff and your coworkers, but really we were actually the most dangerous to one another. So it was something to become aware of. Again, protecting the non-clinical staff, those were among some of the most vulnerable people, because our non-clinical staff, our administrators and registration clerks, they were seeing everybody and they were the least protected. One other thing is, I think a lot of us were unprepared for the emotional toll of talking to alert hypoxic patients. One of the distinct features of COVID is that the patients would be severely hypoxic and very alert. So we were having end of life conversations where people were awake and they were perfectly healthy a day or two before. So really we were trying to discuss whether or not patients should be intubated and make those decisions when this is a conversation no one ever thought of before in their life. They weren't like an end stage cancer patient. They were a patient who was newly critically ill. And at the same time, we didn't have the confidence in our treatment to convincingly say, if you get intubated, you'll do well. So it was that discussion was extremely taxing on all of us. And then the last thing that is just kind of the crash after the crisis. I think all of us had so much adrenaline when things were crazy. And then when you looked at those volume curves after the crisis, initially, our volume dropped off completely. All those people who had disappeared, they took a very long time to come back. Strokes, heart attacks, fractures, all the regular things that we see in the emergency department. We don't know, they just stopped coming. So afterwards, it was very slow and just a lot of time to think and feel worn out and down. So almost everyone kind of had this crash after the crisis. Just a couple words on operational tips, and I could discuss this more if there's time, but basically gaining logistical control is really important, kind of shifting the burden, delegating it to people who can help the clinicians with some of the non-clinical tasks. The less overwhelmed people are, the better the emotional state. And the key to that is feeling effective. So when things feel out of control, people are extraordinarily stressed out. When you feel like you can be effective, emotionally, you're much better. So below is kind of a list of things that sort of helped us manage that. And then some of our lessons learned, the things that I think helped a lot, really seeing the department as a family. Our leadership was very adamant that no staff dies, and protecting our staff was key to taking care of our patients. They prioritized our basic needs, the physiologic needs, the safety needs, and really creating that community of love and belonging. And then kind of using common sense above the guidelines. I think we were very fortunate. My director treated it as though it was airborne before anyone admitted that it was airborne, and fought for us to have N95 masks the entire time. Like I said earlier, communication, having this group chat where we could discuss supplies, we could discuss support for each other, we could have real-time updates, we could problem solve. All of those things were really helpful to have that in real time with all of our attendings on a group chat. Also, our leadership really empowered everyone to be part of the solutions, and that really helped with the top of that pyramid. Providing mental health resources, and then just one of the biggest things among each other is just acknowledging this is really hard. This is really hard for everyone, and just kind of keep asking, how are you doing? And how are you really doing? Because everybody has something that they are struggling with. And when you ask that extra question, people really, it's like that one more question just gets under the surface, and people really share, and having that connection among each other is really, really critical. So how are people doing 1 year later? Many people are actually not okay. Some of these headlines just kind of attest to the fact that everyone knows that this was an enormous trauma suffered by our healthcare workers. And then these pictures kind of, so the two pictures on the right, the fire department thanking us, and then below that, there was a big thank you sign that an artist created and placed in the playground directly across the entrance and exit from the hospital. So every time you'd walk out of the hospital and see this thank you sign, it was really emotional and very much appreciated. And then the picture on the left, sadly, is a memorial gathering for one of our triage nurses who we lost. He'd worked at Elmhurst for 20 years. He had been a physician in the Philippines before that. He was loved by all of EMS, all of our staff. And even though it was right in the middle of COVID, we all came out in N95 masks, and it was packed. And the fire department, you can see down the street how much they loved him. The fire engines and EMS trucks just lined the several blocks down the road. And it was a huge loss, and just how emotional I am talking about it right now. You can imagine the impact of a loss like that on everyone who has to keep working in this crisis. And so that's why it was so critical, and continues to be so critical, to protect our staff and keep everybody emotionally healthy and physically healthy. So we have come so far. The emotional toll is ongoing, and that's why we're here today. Just know you're not alone. I'm going to show a video that shows some providers from Elmhurst talking about how they are feeling 1 year later. And then I'm going to turn it back to Dr. Lisa Elman-Grunther, and you can feel free to put questions in the Q&A box, and then the links to the references and video are in the last slide. Okay. Here we
Done
go.
it without this group of people.
My son asks me every day if I've watched the news about the coronavirus. I try to explain to him that I don't need to watch the news.
You're making the news.
I'm like, we're more making it, but whatever.
On an hour-to-hour basis, things are changing.
Everyone came together very quickly. Barriers broke down.
The hospital is completely overrun.
Numbers that honestly I never thought were possible. We never turned anybody away.
Weeks of sleeping for a few hours and getting up and going forward again.
I was here around the clock every day.
There's trauma there. I mean, everyone's got a little bit of PTSD. You weren't exactly sure how much they knew about what their fate was, but we all certainly did after a while.
It messes your head, your mind.
The blunt, cold reality of seeing things like trucks coming because the morgue was filled.
My coworkers, some of them got sick, some of them, they couldn't take it.
I was more scared to bring it home.
The hardest part was watching patients be alone. We could use things like FaceTime and Zoom and stuff like that, but sometimes the people on the other end didn't have those things. Just having someone hold your hand when you're dying is really something that everybody deserves. So
when it all comes down to it, regardless of who you are, what you believe in, we are all human beings and we've been blessed with one life. And we in the medical field have been charged with defending that life.
The miracle that is the vaccine development and now it being administered widely, it's just, how can you not feel optimistic? And we're always going to be connected forever by this experience.
We gave support to each other. It was very comforting to know that it's not you alone.
I don't know any nurse worth their salt that will be the first to say, oh yes, I'm a hero. If your faucet works and you turn it on and it works, you're not like, wow, this faucet is great, it works. It's doing what it's supposed to be doing. I basically see myself as doing what I was called to do.
Ricky, thank you so much for sharing your experiences, the tools your staff developed, and for that truly heartfelt presentation. And that video was such a great way to sum it up. Okay, so now I'm going to introduce our next panelist. Her name is Grace Kistner, and she's a Project C.U.R.E volunteer who has been working in direct patient care since 2010. As a critical care and perioperative registered nurse, she has specialized in trauma, surgery, neurology, cardiac, and medical intensive care units, regularly with underserved populations, all from varying cultural backgrounds. Grace's volunteer time is spent as an educator for the Alliance for Global Clinical Training, developing clinical training programs and standard operating procedures for Côte d'Ivoire organization, Redemption in Action, and leading C.U.R.E clinic trips and sitting on the medical advisory board for Project C.U.R.E. Like Dr. Lane, Grace also treated patients with COVID in LA at Cedars-Sinai Medical Center and Good Samaritan Hospital, as well as Charlton Memorial Hospital in Fall River, Massachusetts. She joins us today to share some of her experiences in the COVID unit.
Thank you so much for that introduction, and Ricky for your wonderful presentation. I think that there are so many stories out there from healthcare workers on the front lines, and my summary and my story is just one of those stories, but it definitely hits on all the topics that you presented on. I first learned about Johns Hopkins COVID tracker from a colleague and volunteer whose name was Laura while I was in Côte d'Ivoire. I'd been woken up by Aubrey at 3 a.m. on March 12th, saying that there's a travel ban taking place coming back into the US, and you need to get your team out of the country and back home. I had to wake the team, have them pack, deliver our donations, and apologize for cutting clinics short, drive 8 hours by bus to the capital city, and make international connections home while all coordinating these new flight bookings. I heard of COVID before traveling, but I didn't think that was something that was going to affect me in the US at that point. Laura was giving our team real-time updates on hotspots as they spread from China to Italy, and then finally the US. At that point on the bus, I didn't know how serious it was, but I was already hearing the first words of denial of it. Are we overreacting? We only have 1 day of clinic left, can't we stay? The airports and usually packed international hubs were completely dead at the time. The silence was eerie. And after I landed back at LAX, California was already in emergency lockdown. Before the end of the month, 5,000 people had died in the US. When it was devastating New York, I watched the COVID tracker show cases triple in thousands by the day and then by the hour. Talks of redeployment to the ICU for help started, and I remembered seeing the fear of the unknown in my manager's eyes as for what was about to come. I was feeling grateful at first for being in a protected unit with limited exposure. We had the time to watch what was happening as it spread west across the country and prepare for the influx of patients and deal with PPE shortages. By the time I was redeployed, resources were being watched like a hawk, but at least we had them. We transitioned from primary care to team nursing and had a new routine figured out. I remembered hearing there's no emergency in a pandemic. I was anxious to learn about the doctor's rounds, going research that they had ongoing about the new remdesivir trials and other therapies that were going on at that hospital. I felt helplessness when I realized that there was no rhyme or reason to the progression of this disease. I saw older people on high flow oxygen for days speaking in full conversations, and then young people getting intubated and dying quickly. I remember making sure that the patient I had FaceTimed with their spouse because I knew they'd be intubated by the end of my shift and I didn't know the next time that they would talk, or if they would. I pictured myself in the same situation with my loved ones. Despite being in a large, profitable, world-renowned hospital, my feelings quickly turned from grateful to scared and unsupported. The doctors didn't even round in the unit. They turned the now empty waiting room into their physician station and simply texted the nurses to communicate about care plans. One day, I had to call a code stroke on a COVID positive patient who had new symptoms, and I was in complete disbelief when the neurologist walked onto the unit and wanted me to do their assessment for them. They stayed outside of the room, directing me like a puppet through the exam, like a puppet whose safety mattered less than theirs. I didn't feel seen, and weeks went by feeling unseen in so many ways, and then alone. My husband and I had directed our travel lifestyle towards LA in December of 2019, on word of his company starting a long job there by spring. We had just taken a month off together to volunteer with Project C.U.R.E clinics, followed by our honeymoon. But we had gotten settled in LA, and a word never came for our start date. The project had been pushed back to an undetermined date because of COVID restrictions for the number of people that would be working on a non-critical job. Too many months had gone by without a paycheck, and he had to take the next job that was available and still up and running, 3,027 miles away in Providence, Rhode Island. For the general public, cases started going down over the summer, and people were out in the streets, and their lives were moving on from the first surge. The week that my husband had to leave was the same week that George Floyd died. I remember the helicopters hovering over my apartment, flashbangs heard across the city, and the glow outside of my window from fires that got 24/7 news coverage. Curfews meant that the transit I depended on for my work commute wasn't available or safe, and I had to quickly gather 3 shifts worth of clothing and food and stay in a hotel across the street from my hospital. And I had never in my life felt so scared and alone in a new city before. I reached out to new colleagues that in my unit, but I got radio silence back. I have a type A personality and I thrive on control. I wore an N95 and never took it off on the unit where we had some COVID positive patients mixed with others. I got tested every 2 weeks, no matter what, until I was vaccinated. And I thought staying informed and up to date would make me feel like I regained some of that control as cases were rising again going into the holidays. Meanwhile, the CDC was weakening their recommendations from the highest levels. We were unsupported. I'm the only healthcare professional in my family, so I was always asked questions when a new symptom appeared. One night, my brother called me from the Midwest. He'd had a cough and a fever of 102 degrees. I could hear the weakness in his voice. He said, "Mom started coughing 3 days ago, but she says it's just a sinus infection." He doesn't leave the house and he doesn't drive. She had denied the seriousness of COVID and its proximity to her, been lax on the precautions, and now ignored her symptoms. Suddenly, I didn't feel trusted or even seen by my own family. And that night I remember screaming and shaking, begging my mom to take him to the hospital and get herself and her husband tested. I knew that they would all be positive. It seemed like day after day, a new family member or friend or family of a friend was positive, and some of them died. It was everywhere and unavoidable, constantly in the news and personal conversations, and now at home. Devastation and frustration fought for my emotional spotlight. I saw the worst and I knew the consequences of the disease. I felt more anxiety than ever to be in public, to travel to see my husband, and to start a new job. I worked at 3 different hospitals over the past year, but I refused to submit my traveler profile for any job before seeing a copy of that facility's COVID PPE policy. As the travel nurse salaries rose, safety declined, and I was not about to chase that money. Luckily, my current contract is in a very supportive facility with strong protocols, and I try taking opportunities I think are safe to indulge in my normal outlets. Outside travel when cases are low, yoga at home, unexpected time with my husband between jobs, checking in with friends who get it. But a year later and a new administration later, more vaccines later, the effects still linger. Jobs are still affected, relationships have changed, and the variants are dominating. COVID brain fog isn't just a symptom of those who are positive, and healthcare providers have yet to get a break or time to process this past year. I feel like I want to exhale, but I just can't. Thank you.
Grace, thank you so much for sharing your experiences and for that truly heartfelt presentation. We're so sorry for what you've been through, and we thank you for sharing it in order to help others. Now, our next panelists that I will introduce are our mental health providers who can share some tools with you, and we want to thank you both so much for your help in helping everyone else here today. Michelle Berniker has been a licensed psychologist since 2000. She worked at Queens College and Baruch College, respectively, in their counseling centers for many years before starting a private practice. Dr. Berniker specializes in the treatment of anxiety, depression, and relationship issues. During the COVID-19 pandemic, Dr. Berniker has worked with many frontline workers who have been dealing with various issues, including trauma, anxiety, and depression. Dr. Berniker received a BA in psychology from Tufts University and her PsyD in clinical psychology from Furkauf Graduate School of Psychology. Allison Feinstein has been a licensed clinical social worker for over 25 years and recently received her certification as a cognitive behavioral therapist. Allison has worked in a variety of outpatient settings and in private practice. She has extensive experience in working with adults with depression, anxiety, panic disorder, bipolar disorder, addiction, trauma, and stress-related medical conditions. Allison is currently working as a therapist in a large multidisciplinary medical practice in cognitive behavioral therapy department. In this role, Allison has provided both individual and supportive group therapy to frontline workers. Allison received a BS at Skidmore College and her master's in social work at New York University.
Hi, everyone. Thank you, Lisa. And thank you to Ricky and Grace for those beautiful and moving presentations. They really captured the essence of what is going on. I'm Michelle Berniker. You'll be hearing from me and also Allison Feinstein. We are going to focus primarily on some coping tools to help you through these difficult times. But first, we're going to quickly reiterate some of the signs and symptoms of stress. Let me see if I can figure out how to share my screen, however. Let me see. Can you see it? Am I good?
Not yet.
Okay, good. Not yet? Can you see it?
No, we cannot. No.
Okay, hold on. Let me figure out how to get out of here.
Here we go.
Okay, you can see that now.
Yeah.
Okay, I'll get rid of that. There we go. All right. We good?
Yes.
Okay, great. Okay. So needless to say, these are very challenging times. Everyone has been affected by COVID one way or another, and particularly the frontline workers. And these stressors that you have experienced, or we've all experienced, can be immediate, or they can be delayed. And by delayed, it could be a few months, it could be a year, it could be in 2 years from now when you're still experiencing the effects of the trauma that we've all been experiencing. There are some signs that are easy to identify that you're overstressed or traumatized. And they fall into 4 separate categories. There's cognitive, physical, emotional, and behavioral symptoms. We can go through each. The cognitive symptoms that you might experience are memory problems, difficulty concentrating, finding that you're not making good judgments, noticing only bad things. You might find that you're anxious, your thoughts are racing, it's hard to sit down or settle down, and you're constantly worrying about things. Some of the physical symptoms you may experience are, everything hurts. You might be nauseous, dizzy, rapid heartbeat, chest pain. You might feel like, oh, I'm having a heart attack, and it's really a panic attack. And your immune system might be run down. Some of the emotional symptoms that you might be experiencing, you might be moody. You might notice that you're irritable, you're angry. You might snap at your, friends, family members, coworkers. You might feel overwhelmed, feel isolated, especially during this COVID experience when it was hard to connect with people because we were so isolated from each other. Loneliness is a huge issue that's been going around. Depression, unhappiness. Some of the behavioral symptoms, you might notice you change in eating habits, eating more or less. Sleep habits were affected. You might, again, same thing, too much, too less. You might have isolated yourself from others more than usual. Procrastinating, neglecting, not paying the bills, things piling up. And probably one of the biggest things that I've noticed is the use of alcohol or cigarettes or drugs to kind of self-medicate through this time. So what can we do when we're feeling this way? How can we cope? We're in the middle of a pandemic that no one has ever it never occurred to any of us that we would be in this position where we're just seeing people, the numbers running up, and you on the front lines. I had a nurse who said to me in the first 3 months, she couldn't save one patient. And that was just so traumatizing for her. So we're going to introduce you to something we call the mental health CPR. The first thing we need to do when we're feeling stressed or overwhelmed or traumatized is to name it and just acknowledge that it's happening and what we're feeling, right? And not try to run from it. This is probably one of the most stressful times we will all experience in our lives. We can't remove or change the situation. So what we have to do is focus on managing the stress better. One of the things that helps keep us balanced is to create a predictable routine, make a daily schedule, stick to it, know what your day is going to look like, and practice self-care. I know that Ricky talked about this earlier, taking care of yourself, whatever it is that you're doing, you like to do, exercise, any hobbies you have, eat well, sleep well, connect with others is huge. If you can't connect in person, connecting through Zoom or FaceTime or texting or phone calls, good old fashioned phone conversations. Those are really good. And, a lot of these are self-explanatory, but in the remaining time, we're going to give you some more information on mindfulness. Evidence shows that mindfulness and altering our focus has positive effects on our personal mental health. And especially I'm focusing on what's going well.
Okay, thanks, Michelle. So what we're going to do is we're going to take a few minutes to focus on mindfulness, and then we'll move on to altering your focus. So what is mindfulness? It is defined as the state of awareness with intentional focus on the present moment, while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations without judgment. Basically, the goal is to bring yourself back to the present moment and not let your busy mind kind of take you everywhere, but kind of where you are, where you want to be. So an example might be sitting in a chair and focusing on, what you're hearing, or focusing on something you can see by describing it. If other thoughts kind of drift into your mind or your head, that's okay. Don't engage in those thoughts, and gently bring yourself back to listening or describing what you're seeing. Of course, this is easier said than done. And I know that because I kind of gave this a shot when I first was learning about mindfulness. I did something called the toothbrush mindfulness exercise, which the goal was for 2 minutes while brushing your teeth, take in all the senses of what it is to brush your teeth, focus on that, and not engage in any of the other thoughts roaming around your head. But okay, no problem, 2 minutes, can do this. So started off real well, focusing on putting the toothpaste on the toothbrush, what it smelled like, running it under water, brushing my teeth, realized my toothpaste, much spicier than I thought I was doing really well. Next thing I know, I'm not where I want to be. And I'm thinking about everything else, what I have to do later that day, what I did that day. Did I do this? Did I do that? And I just kind of had to laugh to myself because I realized, wow, I have a very active mind. And I wasn't even aware of how active my mind was. And so I really worked at it. And you really do have to work at this. And it gets easier with practice. It's never easy, but it does get easier with practice. And so one thing that was developed is something called a squeegee breath. And this was developed by Dr. Dyke Drummond, and I think specifically for medical providers. And basically, as a medical provider, each time you wash your hands, let's say in between patients, or when you're about to open the door into an exam room with a new patient, stop for a moment, inhale through your nose deeply, and hold for 3 counts. And then you're going to exhale through your mouth, but you want to hear the exhale. So you kind of want to hear that whoosh kind of coming out. And as you're whooshing that breath out, you're going to allow the stress and the worry or the tension out. And then you're going to allow your breath to return to normal. And even this, 15-second exercise can just help you be in that moment. And it's very powerful. Now, breathing exercises tend to be the exercises that people tend to think most when they're thinking about mindfulness. However, there are many different mindful exercises that one can practice. So we have a link and for some additional mindfulness exercises, and we hope that you take a few minutes to look at them and kind of choose 1 or 2 that fits for you. And the other thing is even Google, fun mindfulness exercises. There's toothbrush, there's the eating a raisin or a piece of chocolate exercise. There's the walking mindfulness exercises. So it doesn't have to be just sitting. It can be actually doing something that allows you to be helpful, maybe even more focused than just breathing. But breathing is also a wonderful thing. So there's a couple of apps as well that we recommend. There's the Calm app, and there's also the Headspace app. The Headspace app, there's an initial free trial. I definitely say do the free trial and start not with, I've had people start with the 10-minute ones. That is too much. Start with the 1 or the 2 or the 3-minute exercises. Like for me, 2 minutes was too much. And I had to slowly work myself up. In fact, Headspace may still be providing free service for providers, medical providers. I'm not sure if they're still doing that. So now what we're going to do is we're going to move from mindfulness and discuss on kind of focusing on what is going well. Remember that we can't change the situation, but with the below tools, you can have a bigger picture of what's going on and not just the bad, but also maybe notice some of the good. And one of the first things is to kind of stop the complaining, which I'm not saying any of you are doing, but to be aware if you're doing it, because complaining is contagious. It focuses only on the negative. It actually makes you feel worse for longer. It gives you a sense of helplessness, and it actually fuels the stress. And so we're going to try to focus on some specific things you can do to help you up from that.
So one of the things to note is that we are all, as a species, hardwired for the negative. You can thank your ancestors and cavemen and cavewomen who constantly had to be aware of the negative just to survive their daily lives. If they weren't constantly vigilant, they could have been eaten by, I don't know, a saber-toothed tiger. We don't have that anymore, but we're still hardwired to look for the negative. And in fact, as healthcare workers, we are trained to see what is wrong with a patient and not what is right. And it just reinforces even further that hardwired for the negative. So in other words, as a frontline worker, the negative screams at you even more, but the positive only whispers. The good news is that we can change the wiring, and we can do this with a few different exercises. The first one we're going to talk about is something called the 3 good things. With this exercise, we want you to tap into what went well during the day. This is used to combat the wired for the negative. It's not about gratitude, right? We'll get to gratitude in a moment. When doing this exercise about 3 good things, you want to do this within 2 hours of going to bed, and you want to write it down. It needs to be specific, and it doesn't have to be something grand. You know, I gave a car to a neighbor who didn't have a car. No, it can be little, like I held the door open for somebody, or I bought a cup of coffee for a coworker, or I got a hug from my daughter today and it was great. In the beginning, it can be hard to identify 3 good things because we're so accustomed to seeing the negative. For some people, it can take over 15 minutes just to identify 3 good things, but don't give up. It gets easier over time. Usually by the 2nd or 3rd week, if you're doing it consistently, you'll actually notice that you start to look for the good things that happen during the day, and it isn't so hard to identify them anymore. Statistics show when using the 3 good things exercise, if you practice this for 2 weeks, you get at least a 1 year of benefit daily. You can use, there are a couple apps you can use to record these. If you have an iPhone, it's called the 3 Good Things app. There's a blue smiley face. And the Android, it is called Delightful app. And these are very easy to use and they're free. The next topic we want to talk about is it's called random acts of kindness, which is pretty self-explanatory. But we are all so focused on all the obligations we have to do during the day. You know, our list of things to do is so long, and the number of patients and everything that we're doing. We're so focused on getting things done that we're not so focused on being kind to others. So once a day, try to find something you can do to make a life better for someone else. Hold the door open, get them a cup of coffee, just sit down and say, how's your day going, right? Even just a hug for somebody you can hug in the middle of a pandemic. The results are that you will slowly start to walk through the world differently when you're looking for an opportunity to do an act of kindness and focusing on the good. Don't just take our word for it. There are empirical outcomes of studies that have been conducted. And the studies show that when you use these tools, it lowers burnout rate, it lowers depression rates. People tend to report a better work-life balance. They have higher levels of happiness and improves sleep quality. There's another thing that we can talk about that we're going to do. Allie's going to talk about the gratitude letter.
Okay, so thanks. So the gratitude letter, research shows that when we express gratitude, we are the ones who receive the most benefit and we feel good about the world. Benefits our attention focus on what we have, not on what we don't. We notice the positives in our life. It magnifies the pleasure we experience, improves physical and psychological health, enhances empathy and reduces aggression, and increases mental strength. So in order to, how we do this is you want to think about a time when someone did something for you that made a big impact on your life. And when you have that person in your head, set a timer for 7 minutes and write a letter to this person. Don't spend time beforehand thinking about it, and don't worry about the grammar. The criteria is that it just needs to be authentic and heartfelt. You can then share the letter with the person if you want, but you don't have to. And the amazing benefit is that whenever you think about or reread the letter, you will be kind of awash with good feelings. And I already kind of mentioned what the benefits of doing this are. So you can see that our tools aren't focused on changing the difficult situation. You've all brainstormed and problem solved as much as you can with this pandemic. These tools are about learning to cope and remain resilient, given the difficult reality this pandemic has imposed on all of you. Change your perspective and change your mood. We hope that this has been helpful and that you will try and take the time to use some of the tools we've mentioned. And I believe Aubrey will be following up with an email or something for the list of resources. Thanks.
Allison and Michelle, I cannot thank you enough, and I'm sure from all of us, we feel so appreciative. I can say I was taking notes during your talk and taking some pictures of your slides so I can, practice some of these things myself. So thanks so much.
Wonderful. Well, if we have any time or if there's any questions, please feel free to put them in the Q&A box. I don't see any questions for now. However, I do have a question to get us started, and please feel free to type in your questions as I'm asking this one. So as we know, this pandemic has not only caused a healthcare crisis, but a mental health crisis. This question's for both Ricky and Grace. Has your view on the importance of your own mental health as a medical provider changed during this pandemic? And if so, how? Ricky, maybe we can start with you.
Okay, so I feel like I've sort of always been the person that's there for everyone else's emotional crises. And I just sort of took care of my own by overeating or drinking too much caffeine, like one or the other. But I really started taking the time out to kind of fix those habits and really try to dig a little bit deeper in my own thing. I turned 50. I'm like, all right, let's just clean up some of the bad habits for the next 50. And so I really, I still try to be that person for others, but also I really allowed myself to open up and depend on the people in my life to pick up the pieces when I need it. So.
Interesting. Thank you for sharing. Grace, how about you?
I'm not sure if this is a change so much as an appreciation for what I've already been doing. I realized, several years ago that what I had to do to put into my job just to make ends meet wasn't helping me become a better nurse and be there for other people. So embracing the travel lifestyle and limiting my work life to certain contracts, certain time lengths of contracts, and choosing how long I work and allowing myself to take a break when I need it. That's something that I think I've appreciated more now, even though I've been doing it for a while, setting aside the time for myself.
Oh, wonderful.
I would like to add one thing that it's really important to take care of ourselves, because if we don't take care of ourselves, it will be very hard for us to help take care of others. And in our role, right, as doctors and nurses, and our job is to take care of others, it's really difficult to do if we can't take care of ourselves first.
Yeah, there's the adage of when you're flying, you have to put on your own oxygen mask first. I think that really applies here as well. Well, I think we are going to wrap it up for the day. I want to thank everyone for coming, and many thanks to our wonderful presenters and Dr. Elman Grunther for moderating. We're truly grateful for all of our frontline workers and recognize the toll this pandemic has taken on them. By shedding some light on the importance of healthcare worker well-being, we hope to better support healthcare workers now and long after this pandemic has passed. I'll send out a follow-up email with a recording of the webinar and a list of resources discussed during the presentation in the next few days. Please feel free to share this webinar and resources with anyone who might find them useful. And thanks again, everyone. Have a great rest of your day.